but oftentimes with significant fortunes. And again, I know I'm talking to, there's a lot of clinicians in the room, and generally we know that purpose is something that we all need. We need a reason to get out of bed in the morning. And even if it's reluctantly to go to an office and fulfill a job, but it gets us out of bed in the morning and we go on doing something more or less meaningful. When you are born into financial privilege, and often it's very, very well meant by families and parents, you often see kids growing up knowing that there is a trust fund, knowing that when they turn 18, there will be beneficiaries to either regular payouts or massive fortunes all at once, which relativates the need to pursue one's own interests, to study for a career. And we see that often, especially in very wealthy families, where there's one or two often firstborns, somehow the tradition has it, who are earmarked to pick up the family business and to steer the family office. But other children from that family are often just handed money and no purpose.
And that's a thing that we find very often, you know. So, I mean, the alarm bells for me start going off when you look at somebody's sleep cycle and you realise they're up till 3 in the morning and then go to bed and wake up in 2-3 in the afternoon because they've got absolutely nothing to do, you know. And even if Dad says, well, you can spend your time on any of the 5 family yachts, there's no purpose, there's no wish, no need to do that because they've got nothing to live for. And you know, most people would grow up with how do I earn my crust, how do I move from one day to the next, how do I pay my bills. For these guys and girls, there's just none of that, and that leaves a sense of purposelessness that very often gets fulfilled by seeking excitement, seeking a thrill, which is just a recipe for disaster with addiction usually. And
when you have the seeking for pleasure, which is a normal human trait, I think we all do that. When you seek pleasure, at the same time try to fill a void because you don't have a purpose, and then you put a lot of money into that mix, it becomes very, very dangerous. Because seeking pleasure is one thing when you have reasonable means at your disposal. When you have a massive fortune at your disposal, then very quickly cars and boats and other things are not enough, and very quickly it's about extravagant parties, it's about drug, it's about sex, and when money is not an issue, that curve where this just blows completely out of proportion can happen in a very, very, very short period of time. A dear friend of mine, when he was 23 years old, he landed a job at a hedge fund as a salesperson. No formal training, he didn't go to university, but he was, you know, good in speaking to people. And his first year's bonus when he was just turning 24 was £23 million. 2 years later, he had lost his job, sold the house in Chelsea again that he had bought in the meantime, and he went to rehab for cocaine addiction, and he was completely broke. And he was still getting hotel bills from rooms he hadn't checked out in Monaco half a year before. It's an extreme example, but I spent a lot of time with him trying to understand what's gone through his mind. He just said, there was absolutely no way I could handle this. He came from a relatively poor background, and suddenly, boom, so much money. And you don't take the job seriously anymore. His colleague who got a similar bonus actually quit the job, and they just went off partying. So it's a real danger when you don't have an underlying purpose that you can keep up when you're faced with significant funds.
Yeah, and we often, when we treat somebody, suggest to the parents that we're starting with the children young, looking at not necessarily succession planning, but looking at how they learn to manage money, you know, with the usual chores, pocket money, etc. What age is okay for a credit card? You know, when does the trust fund pay out? 18 or 21? Does it pay out in one big lump sum, or does it pay out in a piecemeal fashion? Because very often, as you rightly said, these kids are just not ready for it. They lived the lifestyle all their lives, but once they've got the money themselves, it goes to pot. And I think it also very often, and it's on the slide there, the rock bottom for these clients are not the same as the rock bottom for people out there. People very quickly exhaust relationships, exhaust their funds, but these guys can carry on for a long bit longer, and by that point significantly damage reputations, health, relationships, etc.
As we talk about the not classic rock bottom, there's another dimension why these guys can carry on much longer. And we get into that a little bit later when we talk about the family dynamics dimension. But often there are people around, be it family members, be it friends, be it employees, who in one way or another benefit from the dire situation of such an individual, and try to cover up for them, sometimes even out of a sense of loyalty that they don't realize they actually do more harm than good. So actually the first graph I showed, I'll just briefly go back to that, because the red bars that show the likelihood of somebody reaching out for help, and we see it's about the same. So even though somebody from an ultra high net worth family is about 3 times as likely to struggle with addiction throughout their lifetime, they're not more likely to reach out for help. And one reason is exactly that, is there is no classic rock bottom. They can go on forever, and sometimes when such people actually do reach out for help, it's because they're hospitalized. It's because their liver is sending dire warning signs. It's because they fell downstairs the 5th time and actually seriously injured themselves. It's not because their spouse leaves them or they're about to lose their job. So the rock bottom is a really hard one, and often happens much later on.
And quite literally, some people get away with murder, you know, with blood money being paid. They never face the consequences for their actions, which is also a big problem. But I think I mean, Jan's absolutely right. It's a U-curve. The more money you've got, the more drugs you do. But the highlight on that slide for me is just that fact that it doesn't mean you're more likely to seek help. I mean, quite the contrary. These people are very worried about stigma, very worried about losing face in society. They are already hounded by so-called well-meaning people, and so they're even more careful to seek help.
And we'll talk about that a bit later as well.
Sure.
Because the dimension of public scrutiny, tabloids and so on is also a reality of that demographic. Maybe let's talk briefly also about isolation and loneliness. We all know the phrase, it's lonely at the top. And there is a lot of truth in that when it comes to wealth. There is several reasons for that. Some are because of the thinking and emotional world of the wealthy person themselves. How can I know if I can trust my friend? How can I know I can trust other school kids? How do I know I can trust a potential spouse? How can I trust that they don't have second motives for their interests in me? And that makes very lonely. And it's not a coincidence that we often see celebrity as couples. We see one movie star marrying another movie star. It's because of a notion that they don't have anything to gain from being with me or seeing with me other than me as a person. Anybody else, and you see that very rarely. I think Pierce Brosnan is an example, if I remember a few years ago, who's actually stayed with a teenage or a sweetheart from his pre-celebrity years. That actually happens relatively rarely. And it's not just that. It's when people of wealth are meeting possible friends, meeting potential spouses, it's not just themselves, it's also their family and parents that always are in their ear saying, are you sure that's genuine? You need to be careful about that person. Or I heard his or her family has done this or done that. So all of that can result really in loneliness. And we know, all the clinicians in this room know, loneliness is one of the key ingredients for mental health issues, for depression, for self-medication of that loneliness through substances and other addictive behaviors.
You used the phrase "it's lonely at the top," but also very common is the poor little rich kid, if you wish, completely emotionally desolate. And I'm just going to add a small anecdote to your scenario of, can you really trust them? Are they truly your friend? I've looked after a family from the Middle East not long ago, where a family friend, somebody that's been in this lady's life forever, had allegedly set up a charity, and it was only when she reached £5 million spent on her house in the Middle East that they thought something's wrong. So she actually siphoned off money from our patient, if you wish, and built a house elsewhere. So that compounds that paranoia, that loneliness, that even people they thought they could trust, they can't, and then they close ranks even more, isolating themselves.
Thanks for this, Liam, because actually I'd like to use this moment or this very topic to make an important point. And I would like the clinicians in this room and also treatment providers to pay attention to this. Because we know that doctors, therapists, who are supposed to be, who should be, who are trusted people of their patients, when they refer a wealthy person to treatment, and it happens to us all the time, they ask for a referral fee. And people from some cultures are less shameless than others, but I think from every part of the world, we've had psychiatrists, we've had therapists, we've had even legal counsels, we've had family office principals who called us, who even came to meet us and said, I have this client for you, and I will make sure they come to you. And I know that they could really benefit from the treatment that we offer. But I'm asking for a referral fee. And now, one thing is the ethics of that, but think about that. A client finding out that their trusted psychiatrist, their trusted, sometimes long-time friends, got a kickback for having referred them somewhere to treatment. That loss of trust that can result from that, that trauma that can result from that, can mean, in an extreme case, that this very person will not engage with treatment again, will not engage into therapy again, because they will, rightfully so, be suspecting that whoever they face might also be opening their hand for kickbacks when they're referring them somewhere. It could ultimately mean that a person ends up without help and dies. I just want that to sink in for a moment. And then we can move on to another topic. Excessive, in brackets, financial dependence on family and parents. We've touched on that a little bit already, that in wealthy families, parents, all things equal, can be more likely to interfere with decisions that the children and teenage descendants take when it comes to career planning. What do I want to study? With regards to friends and spouses and so on. And it's harder, again, all things equal. I'm trying not to generalize, but it's harder, all things equal, for a kid or a teenager or even a young adult to say to the parents, you know what, I make my own decisions because they are financially dependent on the family. And I want to give you one example there. In my previous life, I studied finance and economics here in London, and then I started working as a management consultant. And at uni, I met a young lady who was in my same class, and then went on to work at the same company as me. She was the daughter of an ambassador of a larger country, of the ambassador to the UK. From a country where it's normally wealthy people who get ambassador assignments. And when we started working, our base salary, as far as I remember, was about £2,500 a month. And I learned that her parents gave her 3 times that on top of it, just so she could maintain the standard of living she was used to. At the time, my reaction was like, I'm living fine. So why don't you just move into professional flat share? It's fun anyways. It's what I've done. And her parents had also bought her a 3-bedroom unit in Chelsea already during uni. But now over time, and having worked with a clientele for some time, I really understand it's not that easy. If you're used to a certain comfort and you have never known a different reality, it can feel the same. If I ask anybody in this room to move out of their house, move into a tent, move into a neighborhood that you wouldn't normally want to move into, because it's all relative. You always have to, especially as clinicians, try to think or take the perspective of your clients to really understand them, and to try to develop empathy for their situation. So it can feel like shackles when you.
And if I may add, there's another caveat to that, is that the money we know gets used to control, but very often there's also a real risk that they might be cut off, and even worse, that the clinicians involved in treating these people, if they haven't got experience, actually advise that cutting off of the funds, which is for the client completely devastating. And it sounds sensible, i.e. there's no rock bottom, so let's give them one. It just doesn't work. It isolates them further, it makes them more vulnerable, and puts them to
it can be a
risk.
trauma of abandonment.
Absolutely.
That happens if somebody's cut off.
Yeah.
2 more points to touch on briefly on this slide. Public scrutiny, Schadenfreude, it's a German word, but there is no sensible English translation. Schade means harm, Freude means pleasure or happiness. So Schadenfreude is when people draw pleasure or happiness from the harm that happens to somebody else. And tabloids, scandal stories are a typical example of that. And a few years ago when I read about, when we were reading about Lindsay Lohan going from one rehab to another rehab, there was a general public reaction to it, to that situation. It's like, she has it all, but she's messing up. So in a way that makes me as a average person feel better. And people of wealth, and particularly people of wealth who have a family name to it, that's a reality that they are aware of. So again, that's one of the reasons why they're not more likely to reach out for help, even though they are much more likely to suffer from mental health and addiction issues, if you remember the first slide. And another point that ties into that is actually a fear for safety. And fear for safety doesn't only mean physical safety. So fear of kids being kidnapped, or somebody throwing a bottle at you because they don't agree with what you stand for, but also more and more cybersecurity and social media and online extortion becomes a real risk. Again, if you look at the average billionaire family, they will have very, very clear rules in place how their kids can use social media. For the kids, that's again a limitation of the freedom. Which again ties into all of the points that we've been talking about. Do you want to add something to that? So
I think we the fear of being publicly shamed or seeing it happen to, because remember, it would usually be that when it happens to somebody, it might even be their friends, given the circles they move in. And that, for many, many people, is a reality that they then feel the very same. Although they sort of relished it happening to a competitor or somebody else, the likelihood is it might even happen to them. That's one point just from there. And then also the whole, and people that have in this room have looked after patients with bodyguards and entourages. Whenever I'm involved, firstly I'm usually, and it's natural, somewhat awestruck that I'm going to see one person and 15's just walked into the room, but also it's very usual for that patient, but in my mind also very unnatural. That's not the way people usually seek help. They usually come by themselves with a concerned relative. And I think it's a very unique setting, the whole bodyguard thing that we see quite often. And there's a real safety aspect to it. When I see people, I often suggest they book out the whole afternoon because we're going to clear the clinic for them for safety. But it always feels somewhat artificial, and you have to put that beyond you and to see the patient for who they are.
Actually, that's a point that we want to pick up when we talk about the therapeutic dynamic.
Sure.
A last point on this slide, it just says ADHD, and it's a little side note there, but when you see self-made entrepreneurs, there is a high likelihood that they have an underlying ADHD issue. I don't want to go into a lot of details there, but if you see some of possible traits of ADHD behavior, it does make sense when you see such a client. So financially successful, very, very, very hardworking, committed to the work. It more often than not, it makes sense to ensure they get a proper ADHD assessment. I think every single self-made entrepreneur we've had as a client did get a positive diagnosis in the end.
Do yourselves a favour, have a look at entrepreneurship, ADHD, see which names come up. Definitely, it's all there.
Yeah, some very
interesting people.
Very well-known people.
And bizarrely, the opposite happens too. If you don't treat the ADHD, they're at risk usually, at risk of getting more unwell, and also at risk of losing their success.
Right, so let's talk about the therapeutic alliance. And some of the things we've talked about, what are the implications for when we as clinicians work with this demographic. And I think I would like to get back to the point that Leon just mentioned. So it can be that you were meant to see one client and 15 walk into the room. It can be that you're called to a home or hotel visit and you realize they've rented out a whole floor or sometimes even a whole hotel. That's extreme cases. But there are a lot of wealthy people out there who are unwell. Some of them reach out for help. And when you face them as clinicians, you're also faced with their reality, with their life of wealth. And the first point there, we wrote, all clients are not the same. What do we mean with that? For me, it's a red flag when a clinician tells me that I don't care if Richard Branson or George Clooney or anybody walks into my office. I will react the same way. I will treat them the same way as if anybody else walks into my office. And that simply cannot be true. We as human beings, we do have a reaction to wealth. We have a reaction to fame. And it's our professional duty to do justice to this reaction, to acknowledge this reaction, because otherwise it will be the elephant in the room. Because if Richard Branson walks into your office, he knows that you know who he is. So now we get into transference, counter-transference topics. I think it's very, very important to just acknowledge that and possibly address that you need a moment to to digest, especially if you haven't been forewarned. And for us, more often than not, when we work with high-profile celebrity clients, we don't know until last minute, or we don't know until we actually walk into the room, or they walk into the room, who is actually going to be sitting there. And I think you've had this experience a few times in your career.
Indeed, I think just one step back from that, and what Jan said there is absolutely true. They are not the same as every other client, you know. And when we started working together back in 2012, I remember you describing saying this unique bunch of people, and they are. They're unique in the way they live. They're unique in their spending power. They're unique in their family dynamics. Everything is different. But it's perfectly normal for a clinician to think he or she will sit there, or a therapist saying, I'll just be myself, I'll just be normal, I'll just treat them like anybody else, until they walk through your door. And I think if you can't acknowledge that, you're already in trouble. And I will just share one story of a chap that sadly died a few years ago, but he was a very, very well-known British pop star. And he walked through my door and I thought, oh, he's here. That's just amazing. Came with his wife and his sons and so forth. And then within 10 minutes, he got up and he stormed out. And I remember thinking that I'm going to run after him. I have to talk to him. Something's wrong. And I sat it out. And he came back, and we effectively treated him in the end. But I think it's important to recognise that, you use George Clooney there. I'm sure most of us will be awestruck when he walks through, but we have to acknowledge that. And the key in that is supervision, supervision, supervision. If you cannot share the fact that you were awestruck, something's wrong already.
And then we can come to another topic that
Sure.
that we as clinicians often face working with that specific demographic, and they can be a very activating clientele. They can be tremendously frustrating to work with, and when we are asked to work with them, to help them deal with and process their suffering, we have to always keep in mind we are dealing with a vulnerable human being. We cannot just dismiss and ignore their reality, because it's also partially what makes them and what makes their suffering. But the reality is, when somebody of significant wealth goes to rehab, when they don't like something, they can just walk out. Sometimes they even have their own plane just waiting for them. They have the means. And so the approach when you work with them, either in individual therapy or as a treatment provider, I'm saying pragmatism is something you always have to keep in mind. You have to meet them where they're at. It's possibly a bit more diplomacy required, all things equal, than with your average client. If you're too confrontative, they will shut the door on you. That's a lose-lose-lose situation. They will lose, the family will lose, and you as a clinician also have lost. So it sometimes takes a bit of more trotting around, getting to know each other, and building that trust. And that trust is not built, within the first therapy session, because as we remember from an early topic, people of wealth have an ingrained sense of mistrust towards anybody from the out-groups, basically anybody who is not as wealthy or famous as they are.
And I think it's fair to say that they are used to getting what they want. So if they don't like what they see in front of them, they'll dismiss it and move on. And that's where the therapeutic rapport is so important. I mean, that patient has to really believe that you're there to help. And if you can't do that, you've lost them already.
Maybe in this context we should also briefly talk about how to deal with flattery and generosity. Generosity meaning gifts, meaning tips, or invitations to a wedding, to a gala. And maybe I'll let you directly talk about this.
I think the easy way in for me there is to think back to when I was a specialist registrar, when in the mid-90s, it was common practice for the pharmaceutical firms to fly young doctors all over the world for conferences. And most people that have been through medical training will now know that it's hard to get even a biro out of a pharma firm, whereas before we were literally wined and dined all over. And the rules then changed, the ABPI changed the rules, and the very simple rule was that it shouldn't be a gratuity that any reasonable doctor would be able to afford not be able to afford on his or her usual salary. And that shifted everything, so we now get biros. But I think this is quite important in this clientele, because the gifts or gratuities or flights or holidays or invites are way out there. It's something that most people wouldn't reasonably afford, and that again highlights for me supervision, because it's a very tricky situation. You get somebody, celebrity, somebody famous, somebody that has a lot of money, that is used to, also culturally sometimes used to giving gifts just for the sake of you've gone to their home, therefore you will receive a gift. And you've got that difficulty whether do I accept ethically or do I insult by saying sorry I can't, and that might be enough to break the therapeutic rapport. You might lose your patient just there. So I think again that comes back to supervision. I mean, there are simply things that you from a monetary value just cannot accept, and no GMC or NMC or BACP or BAP or BPS would condone that. And I think that's very black and white, but how you approach it with the client is not. That's where the trouble lies. And I think we've had situations where, if I may, you can fill in, where people have accepted initially, went to supervision, and then gifted to charity and told the client thereafter, which is an acceptable way. That might still not be good enough for that client, but I think it highlights, I mean, anybody in this room probably have accepted, the bottle of perfume or, the tickets to whatever that would be reasonable. You feel, look, I'll mention it at my appraisal, but I don't make much of it. But when you're being gifted, £50,000 worth of painting or some kind of relic or cash check or whatever, you have to go back to supervision, I think.
And when you're faced with that, it's easy. You don't expect it, so you don't know how to react.
Absolutely.
So you're probably lost for words at the moment. An easy way out, or a thing that we would recommend to do is acknowledge the size or the significance of the gesture. Say I will accept it for now, but it's my professional duty to go back and discuss this with my supervisor or supervisory body, because we do have professional standards that guide or even dictate what's okay and what's not okay, and then I will come back to you and we can discuss it further. So that's a non-committing way, but at the same time you can avoid possible insult by not accepting a gift, and then you actually have to go back and also do this. So we have a few more minutes, so we should talk about family dynamics. That 2 up there is not a footnote. We put it up for family dynamics squared, because in our experience we know the family dynamics is something that we often face as clinicians as an underlying topic that's there even when you don't work with family, but you work with an individual patient. So you have to try to make sense of those dynamics and see what needs to be addressed with the family. The squared is there because in our experience, when there is significant wealth or fame involved, these family dynamics can take a whole different complexity, proportions, and a force that can also be tremendously destructive, not only for the family members, but if you're not careful, to the therapist and the therapeutic team.
If I can add, I think the squared is definitely supposed to be there. These are not normal family dynamics. I mean, usually in my experience, if you take a family history very carefully, you'd find that these are often families that have fled countries, that have been victimized, that have been taken for a ride, that have been blackmailed, and they close ranks and they look after their own, and that brings problems of its own kind. And that's something that as a treating team we're acutely aware of, because they are very, very powerful. Often in the same vein of family of origin trauma, you've got generational trauma, and they've looked after each other forever, and they're going to carry on doing that. And for a therapeutic team to intervene and position yourself in a position of trust is really, really hard, because they are profoundly careful. I think that highlights what we tend to see.
Another thing that we often encounter is the difficulty when a family or parents pay for the treatment of an adult child. In Switzerland, the legal age from a medical secrecy perspective is 14 years old, and then in some cultures even more so. It's just normal that the parents take care of everything, but at the same time they want to know everything. What do you do as a therapist or a treatment provider when you work with somebody, with a person, with an individual, and there's a lot of sensitive issues that you need to work through? And then you have the mother on the phone, you have the father waiting in front of the office and asking, how did it go? What did you talk about? And it's not just straightforward as I can't tell you. I have, this information is privileged, because there's a real risk that the family will just pull the plug on treatment. Well, if you're not cooperating with us, we'll go somewhere else. So again, it's diplomacy that's required, and it's not a clear line. It's again pragmatism. In some cultures, it's okay, or it's expected, or you have to discuss some topics with parents that you otherwise would not. At the same time, that's just what I would like to say to, if you ever face such a situation, you always have to be transparent and open to your client and say, I've been asked to discuss this with your parents. Let's discuss it first, and then I will have to face that inquiry. Do you want to add something?
I think for me it's a really, really tricky situation, because very often it feels like it should be a one-way street. The client tells you something and says, I can't let dad know this. And very often you find out dad already knows everything. And you find that there are very, very little secrets, because everybody knows everything about your poor client, because he or she's probably been scapegoated and been the problem for the last 25 years. And what Jan's saying there is for me crucial. It's about transparency with your client. It's about always working with that client, saying, but I'm trying to engender trust between you and I. This therapeutic alliance is crucial. There are things that you may not want to share with your parents. I'm going to tell you they probably already know. And that's really, really tricky, because they do financially control, and they control the process, and they are used to getting what they want, which makes it really hard. And I think it gets very tricky, but important to have multidisciplinary meetings. Family meetings with the right people there is also crucial.
And you mentioned scapegoat. And actually that's a bullet point there, black sheep or scapegoat. What does that mean now? We see that sometimes with wealthy families. So one individual, one of the kids often is just really not doing well, and everybody else's attention around well-being and health is focused on that sick member of the family. When they come to treatment, we sometimes encounter the situation where we realize suddenly family members are starting to torpedo the treatment process. That doesn't make any sense. But actually it does make sense, because a scapegoat is particularly in with such entrenched family dynamics, when it's about significant wealth and there's also politics around, you know, who gets how much down the road and so on. It's often convenient for a family to have somebody they can point the finger to and say, that's the reason for all our trouble. So this is something to, especially when there are family meetings or there's a family therapy component to the work you do, be aware of this. When suddenly there's crossfire, it could be for that very reason.
And I think to add, if the treatment, for whatever reason, and the team's not aware of these family dynamics, the team will become the scapegoat and the focus of all that anger and the fact that you couldn't help, and therefore you must be useless.
And that brings us to the last point of this presentation, and just on time. Difficult choices for therapists and providers. And we've faced this with common clients in the past, and a few times only, luckily, but it does happen that the treatment provider, the therapy team, or the individual therapist becomes the scapegoat. And this can just happen out of nowhere. There's no warning signs, but it's families whose coping mechanism with the problems has always been externalizing and blaming others. And sometimes, and that's why we say it's difficult choices for therapists, sometimes it does more good than harm if you as a therapist or a therapy team say, we're very sorry, but we can't help you any further. Because if, and it's very hard, because we have the professional duty, we become clinicians because first and foremost we want to help people. But when we realize we can't help, and when we realize we are being seen as the problem or part of the problem, it's not sometimes not the right thing to stay on board and try everything to help, but to have this conversation with the client or with the family that this is not working out. If there are questions, we'll be happy to answer them now. There's a microphone for you.
Hi, really enjoyed the presentation, very, very interesting. Thank you for the time and effort that you put in. One of the things that really interested me was when you spoke about the acknowledgement of being awestruck, and I was just wondering, because the first thing that stuck out for me, based on what you said at the beginning of the presentation as well, was that it felt to me like you're almost creating the environment that's the problem in the first place. So I'm just wondering how you transfer, or what some of the methods are for transferring from being awestruck and this person being kind of different, if you like, to creating an environment where they can start to recover and feel a part of.
I can probably answer that one. I think the very simple stock answer is that it becomes painful very quickly, and the awestruckness goes very quickly. So although these clients present with unique family dynamics, you know, they're three times more likely than Joe Public to present with depression, anxiety, and addiction, you will find that at the first consultation, maybe the second, you're still a bit in awe, and then very quickly the very real mental health stuff comes through and you become that clinician you know you are. I think that you have to take it back to supervision always, and to acknowledge that it's there, to acknowledge if somebody walks through your door that you are going to be slightly taken aback. You know, they live on Instagram, don't they, or on the news, and suddenly they're in your therapy suite. So I think it's the acknowledgement that it happens, it's discussing it in supervision, and the realization that it's going to happen, maybe one session, maybe two, maybe three, but thereafter the nitty-gritty mental health stuff will come through, and that's what you're going to be focusing on. So I think supervision and a bit of time.
very...
There's a mic coming through for you.
Thank you. Thank you for a great session. I'm interested in the scapegoat element of it, and that child being the sort of valve for uncontainable feelings for the whole family. And the question is about the systemic approach and how willing these families are ultimately, because when that child recovers, a whole lot of other things are uncovered, and yeah, that's the question. Thank you.
So the crux of the matter is there when we deal with, and it's usually rather big families, we make sure that we've got a family therapist looking after the family away from the client to address some of those dynamics, and we also have a therapist within the multidisciplinary team to look at the dynamics within the team, because very often it replicates. But the scapegoating phenomenon is extremely common. You will find in most families there is the one that didn't succeed at school, or did but badly so. They didn't go to the university of choice and did whatever he or she pleased. And very quickly all the family problems in the family's mind come from that one individual that's not doing what he or she are expected to do. And you're absolutely right, the systemic family approach is what we do. We tend to have a family therapist on board, usually with a trauma perspective, and we have a therapist within the treating team to explore the dynamics within the team itself. You cannot leave them undone.
And I'm just thinking of one specific case where, you will face situations where there's just absolutely no way the family will not engage in any therapy, or any sessions that they do attend, they will just keep externalizing. So in an extreme case, and it's I have an example in mind, we switch to a different mode as a therapy provider, and the mode is focus on that individual who has been entrusted into our care and help that person survive. Maybe not thrive, maybe not make the fullest out of their life, but given all the limiting factors that they are, and they are often just a given, they can't just leave the family, they can't just move away. Let's focus on how can we help you to survive in that toxic environment. It's pragmatism again. Please.
Yeah, I thought that was a really good presentation. I just thought, in terms of you saying there's not like a real rock bottom in a sense, and they just can continue because they've got almost like an unlimited runway. How do you target the client and like market to them so that they get the help?
That
Probably
is
one of the hardest things we do.
Yeah.
Because I've sat with many a young man, young woman, thinking with him or her, what are you going to do with your life? And that's just it. The sense of purpose, and it's not that you suddenly need a bevy of life coaches. They just need to find which things interest them, what do they enjoy doing, what do they want to do with their lives. Because for many of them, the succession to the chairmanship is sorted. They're going to do that whether they want to or not. But it's finding what they enjoy. So boredom, lack of purpose are the big ones. These guys and girls go out and spend as much money as they want, buy as many sport cars as they want, as many villas as they want, but they're still empty. And I think it's that lack of purpose. And that is the hardest thing for us, finding something that they really want to do.
And I don't know if it was part of your question, but how, if there's no classic rock bottom, how can we make aware that there is help and that they actually do need help? And that's one of the reasons also why we're here, and also one of the reasons why there's not only clinicians in the room, but there are people working with that demographic. And that's one of the missions that I'm personally on as well, is we need to spread awareness. So when, as a divorce lawyer, when as a family office principal, any other advisor, possibly even a nanny, when you work with that clientele and you realize there is something just not right with that person or a dynamic as a whole, what can I do? Whom can I ask for advice? And that's often the first step. So more often than not, it's either concerned family members or it's professionals working with the family that are the first ones to raise the flag, and not the individual themselves. Because again, we know denial, and denial takes a whole different dimension when there's a lot of money in the game. We are out of time. Thank you very much for having us and for your attention.